Hello and welcome to Module 4, Chapter 1. This chapter provides an overview of the topics that will be covered in Module 4. This chapter is split into 4 sections. First, we'll explore the 7 chapters that make up this module. Next, we'll introduce you to your trainers. After that, we'll guide you on what to do next once you have reviewed the chapter. And finally, we'll advise you on how to get answers to any questions you might have. So let's look first at the 7 chapters that make up Module 4. Participatory Learning and Action Groups for Maternal and Newborn Health, or PLA-MNH for short, is an effective, low-cost, sustainable and scalable approach for improving maternal and newborn health and reducing mortality. It works particularly well in rural areas where mortality rates are high and where access to services is low. The approach works by organising individuals concerned about maternal and newborn health to take collective action to address their concerns. This course supports the implementation of participatory learning and action for maternal and newborn health programmes. The course consists of 11 modules. This presentation is an overview of Module 4, which covers topics related to supervising PLA-MNH groups. As this word cloud on Module 4 shows, you'll hear a lot about groups, facilitators, meetings, monthly reports, observation, supervision, amongst other terms. By the end of the module, you'll have learnt how together all these terms relate to supervising PLA-MNH groups. Module 4 is divided into 7 chapters. You are currently in Chapter 1, which will give you a brief overview of Module 4. Next, you will move to Chapter 2, which covers the responsibilities of PLA-MNH group supervisors. Chapter 3 will cover the knowledge and skills that PLA-MNH group supervisors need to effectively supervise groups. Chapter 4 explores how PLA-MNH group supervisors should report on the progress of the PLA-MNH groups. Chapter 5 looks at how PLA-MNH group supervisors should link PLA-MNH groups. And Chapter 6 will cover how PLA-MNH group supervisors can build the capacity of their group facilitators. Finally, Chapter 7 provides a brief summary of everything covered in Module 4. Now, let's introduce you to your trainers. Your trainers are from Women and Children First. Women and Children First is a UK-based NGO working internationally to ensure that all women, children and adolescents can survive and thrive. Women and Children First develops and tests low-cost, community-based innovations that can support women, children and adolescents to overcome the challenges that can kill them, harm them and hold them back. Women and Children First's flagship innovation is the PLA-MNH approach. This has been rigorously tested and is ready for scale-up. Alongside this, Women and Children First is also incubating a number of other early-stage innovations. These are currently undergoing prototyping and testing. Women and Children First was established in 2001 by Professor Anthony Costello and his colleagues. Professor Costello is a former director of maternal and child health at WHO. Between 2002 and 2013, Women and Children First focused on designing and testing the PLA-MNH approach. This work was done in collaboration with the UCL Institute for Global Health. Together, these partners linked with local organisations in 4 countries and conducted 7 randomised control trials. In Nepal, 1 randomised control trial was conducted in collaboration with MIRA. In Bangladesh, 2 randomised control trials were conducted with the Diabetic Association of Bangladesh Perinatal Care Project. In India, 2 further trials were conducted with ECJUT and SNEHA. And finally in Malawi, 2 final trials were conducted with My Mwana Project and My Kanda Project. These trials across the 4 countries established over 2,500 PLA groups and reached a population of almost 7.25 million people. Between 2005 and 2019, the evidence for PLA-MNH started to grow. The trials started to show how impactful it could be on maternal and newborn health and how it could help to reduce mortality. As a result, Women and Children First started to focus on supporting training and scale-up of the approach in new areas. This included supporting the scale-up of PLA in countries where it had previously been trialled. In Malawi, Women and Children First continued to collaborate with MyKanda project to scale up to new districts, and also with new partners including Adventist Health Services. In Bangladesh, Women and Children First continued to work with the Diabetic Association of Bangladesh to scale up to new regions. Women and Children First also started working with new partners to scale up the approach into 9 new countries. This included working with Health Poverty Action to scale the approach into Latin America, specifically El Salvador, Guatemala, Honduras and Nicaragua. Women and Children First worked with the Well Body Partnership in Sierra Leone to scale up the approach in Freetown, and also with UCL in the UK to scale up the approach into a borough of London. Women and Children First also collaborated with AMREF Health Africa and Doctors with Africa QAM to scale the approach into multiple districts in Uganda, and also with Doctors with Africa QAM and the Family Guidance Association of Ethiopia to scale the approach into regions in Ethiopia. Finally, Women and Children First also worked with Health Poverty Action to scale the approach in Myanmar. Through these scale-up activities, Women and Children First was able to support partners to establish 2,500 more PLA-MNH groups. These groups in turn reached a further population of 5 million people. Now, let's put some faces to the Women and Children First voices you'll be hearing during this course. I am Mikey Rosato, a PLA Master Trainer and CEO at Women and Children First. I have a BA and MA in Anthropology from the University of Cambridge, an MA in Psychology from the University of London, and a PhD in Global Health from University College London. I am fortunate to have almost 20 years' experience in the design, implementation and evaluation of the PLA-MNH group approach in 13 countries. My PhD was also on the PLA-MNH group approach. It explored the mechanisms through which the groups work. And what have I learned from my PLA and MNH group experiences? Well, I've been lucky enough to visit several hundred groups and observe over 1,000 meetings. And the truth is that I've learned far more from these PLA-MNH groups than I've ever taught them. But what strikes me every time I meet a new group is how similar they are, even across countries, but also how distinctively different they can be even within the same district. Although every group is guided by the same approach, has the same drive to address maternal and newborn health issues, every group is made up of a unique set of individuals, bringing together a diverse set of ideas that enables them to solve problems in innovative ways. Every group goes on the same journey, but takes a different path. And ultimately, that is the power of the approach. Unique local solutions, common global health problems. I hope this course inspires you to go on and support PLA-MNH groups practice, and I look forward to learning more about the paths your groups take to improve maternal and newborn health and reduce mortality.
My name is Annemein Sundal, and I'm a PLA Senior Trainer at Women and Children First. I have a bachelor's degree in public health at the VU University in the Netherlands, and a master's degree in global health and development at University College London in the UK. I have focused my career in global health and development on maternal and newborn health and community mobilization. My master's dissertation explored the sustainability of the PLA group approach in Nepal, and I led on the publication of this study in a peer-reviewed journal. My experience as technical officer and now programs manager at Women and Children First includes design, training, implementation, monitoring and evaluation of the PLA group approach. I have extensive experience of delivering multiple trainings to various audiences, such as government and NGO staff, as well as local implementation teams, both in the UK and abroad. Why do I value community? I strongly believe that stronger communities make a real difference to the people who live in them. Community is by definition a noun. It describes a collective of people. but through my experience of working with the PLA group approach and wider community mobilization approaches, I have come to view it more as a verb. It is active, has motion, and impact. The PLA group approach enables a community to come together, work collaboratively towards a common goal, and realize impact as a result.
My name is Joanna Drazdewska, and I am a PLA senior trainer and head of programs at WCF. I have a bachelor's degree in international relations and a master's degree in development studies from SOAS, University of London. I have been working in global public health since 2011 with experience of both health systems strengthening and creating demand for sexual, reproductive, maternal and newborn health services in Africa and South Asia. My main focus now is community mobilization for better health by implementing, innovating, monitoring and evaluating and training in the PLA group approach. What PLA has taught me? What really convinces me about PLA groups, aside from the rigorous evidence behind them, is how they can make seemingly impossible goals possible. For example, when women from Malga, Ethiopia, tired of waiting for the government to build the promised maternity waiting home, took matters in their own hands. They made an action plan and presented it to the government. And together they cooperated to build the home. Or when teenagers in Oyam, Uganda, feeling empowered by their PLA group, spoke openly but respectfully to their parents, that they don't feel supported by them and how their support really matters to their health and well-being. Individually, most would not feel brave enough to take these steps, which an active PLA group made possible.
So, what can you do now that you reviewed Chapter 1? First, you should update the Module 4 Progress Tracker. And second, you should do Exercise 1.1 to strengthen your learning. Having reviewed this presentation, you may now have some questions. If so, please don't hesitate to contact us by email or phone. One of the team will be happy to help. Enjoy the course!